Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, this particular study really strikes home, especially when it's very much in line with what I tell patients to do on a regular basis. So this has to do with chronic neck pain, which obviously I see often, and our approach in the office in general is that the more somebody does out of the office, the less they will need us in the office. So couch potatoes are notoriously hard to fix. Athletes respond much better. And if you're not moving, my recommendations are always going to be to move more. There is no musculoskeletal condition that will do better with you sitting on the couch. They all require movement to respond. And so this was a review looking at a lot of different studies and kind of narrowing it down to what different approaches work. And the three things that they kind of looked at were, so for me, I always say I'm a much bigger fan of exercising, not exercises. And that goes for the neck, that goes for the low back, the shoulder. I would rather see somebody out there moving than spending a half hour every day doing neck exercises they learned in rehab or chiropractor's office 20 years ago. My thought is we get everything moving the way it's supposed to, and then life becomes rehab itself in most conditions. Certainly there are scenarios, post-surgical, post-trauma, there's a lot of different exceptions, but in general, we need to be moving, and if we can get those tissues loosened up and moving the way they're supposed to, then they're going to respond. So they looked at resistance training. So basically, most of the studies looked at not neck resistance training like with any of the collars or headbands, but more shoulder, like shoulder shrugs and abductions, so shoulder, lateral shoulder raises, those things that are generally neck upper trap related, less related to the neck itself. So those were largely what was covered in the study. Coordination training, so think like chin tucks are probably the big one, but different ways to restore coordination, which by the way, exercise, things like yoga, martial arts, pickleball, I would have to say, those things also kind of wake up the neck and help restore some of that. And then they looked at passive stuff, which is what happens in most offices. For us, we do, whether we're talking about manipulation, soft tissue work, interferential ultrasound, those kind of things are passive modalities. So how did these all play out? They found that the people that did resistance training with coordination training had the best outcomes. Well, that makes sense, but those are things you can do at home or part of getting in the gym and working out, because those types of shoulder, upper trap exercises, rhomboids, are all going to be part of working out anyway. And then they found that aerobic training with resistance training was next. So warming up, I know when something's stiff for me, like I'm nursing a jammed ring finger right now, and while it's a little bit stiff now, I'm still working on it. It will get better. But when I go to class and my body temperature warms up, like it feels much better. I don't want it jammed, but the movement itself feels better when my body temperature is warmer. So when we're doing aerobic exercises and short burst versus sustained, I've certainly covered that. I'm a huge fan of short burst. And you combine that with resistance training, those get some of the best, the next best outcomes. And then passive approaches still showed benefits. So in a perfect world, we combine all of these together. So what do we look at? They actually broke it down into METs, so metabolic equivalents. And those who did 420 METs per week seemed to do the best. So what does that translate into? Something like 20 minutes of moderate exercise per day. So moderate would be like walking around the block, light treadmill, light elliptical, anything. Or 70 minutes a week of vigorous exercise. So for me, martial arts, short burst, those all kind of fit into that. But the big component here is we have to be moving. Nothing in your body will heal as well, or if ever, if you are not moving. You have to be an active player in your recovery from anything. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.